Hi, my name's Danny Van Leeuwen. I'm also known as Health Hats. I have multiple sclerosis. I've been caregiver for my grandmother, my mother, and my son during their end of life journeys. I've been a registered nurse for more than 40 years now, and I'm known as Health Hats because I wear lots of hats in healthcare. I've been blogging for about 5 years weekly at www.health-hats.com. So I really care about people at the center of care. So people at the center of care are patients, parents, caregivers, clinicians, support staff, direct care staff. So people who touch people on the health journey. Now, I think a lot about the health journey. We're headed somewhere with our health. Whether we're planning that trip or not, we are heading somewhere. And we're never actually there. It's a continual journey, of course, until it isn't. So sometimes we have a map and sometimes we don't, and it's just like any other kind of journey. It's, where are we headed? Are we going to work? Are we going to the grocery store? We're going to go visit our in-laws. We're on a road trip. And there's always stuff to do on a journey. You have decisions to make. Are we going to stop for gas? Does it need maintenance? Do we need to stop and rest? Are we going to take a right? Are we going to take a left? Where are we going to spend the night? Who's going on the trip with us? So it's the same with a health journey. And the map of a health journey is filled with who's going to do what and when are they going to do it. So this is my first ever video cast. So again, thanks for joining me. I wanted to start talking about this destination on the health journey. Where are we headed? Where do we want to go? What are your personal health goals? Your personal health goals are your destination. So I'm starting with personal health goals because managing best health is work. It's work for people. So I want that work to get me closer to my destination. So what do I mean by best health? Well, best health is living at your peak with whatever limitations you have. And everybody has limitations. So some people don't have a car. Some people can only walk a few blocks. Some people don't speak the language. Some people are single with 4 kids. Some people have a sprained ankle. They have a headache, on and on and on. So best health is operating at your peak, whatever your strengths and weaknesses are. So knowing where you want to go, what your destination is, what are your personal health goals are vital to getting there. There is so much noise in life that knowing where you're trying to go helps you stay focused. So I have secondary progressive multiple sclerosis. So my personal health goals are to progress as slowly as possible, to do nothing to interfere with my pathological optimism, and to keep playing my baritone saxophone. So my health team is my family, my doctors, my friends, my readers. They all know my goals. I have a plan to reach my personal goals. Progress as slowly as possible. Don't mess with my pathological optimism and keep playing my saxophone. So the things that I do to get closer to my personal health goals is I take my medicine as prescribed. I maintain my strength and balancing exercises that I do every other day. I walk 3,500 steps a day. I wear my brace when I'm outside. I rest when I'm tired. I try to continue meaningful work at least 2 hours in 4 out of 7 days. I play my bari sax 3 to 6 hours a week. I actively work to reduce manageable stress. So I have a plan of how I'm going to get to my personal health goals. So I talk with people a lot about their personal health goals. And nobody has an easy time coming up with their personal health goals. It's hard. People don't think that way. But really, it's not that difficult. It's like, so people who are well usually want to stay well. And people who have an acute illness, so they have a cold, they have a broken leg, they have a stomach ache, they want to get over it. And those who have chronic illness, like me, want to manage as best as possible and have a meaningful life. So let me just share with you some personal health goals that I've heard over the years as I've talked to people about it. So those people who want to stay well, they want to own their health. They want to drink more water. They want to eat well. They want to get enough rest. They want to be active every day. They want to manage stress. They want to manage weight. They want to have the best relationships possible. They want to do meaningful work. They want to participate in the community. They want to take out the garbage. They want to wash the dishes. They want to cook their meals. They want to celebrate success. They want to enjoy life. So these are people who are in the stay well group. So then there are the people who are just trying to get over it. They have something acute going on. Well, they have the same goals as people who want to stay well. In addition, they want to do what they've committed to do to get over it, take their medicine, whatever. They manage their pain, adapt to whatever change in function or regain function, and get rest. So then there's people like me who have chronic illness who are trying to manage as best as possible. And so they have the same goals as people who want to stay well and people who want to get over it. So, plus they want to get help. They want to build a team. They want to enlist a care partner. They want to become expert in their conditions. They want to pay as much attention to their caregivers as they possibly can. They want to join a support group. They want to prioritize what really matters. So these are examples of some goals. Oh, look, I see I have a question here. Somebody's asking, I don't have health goals. How should I come up with some? Well, that's really a good question. So I didn't come up with my health goals by myself. I did it with my family. We discussed it and they helped me. It took a while. So is there somebody that can help you? Now, this weekend, I was, spending some time with friends, and we were discussing this. And they said, I don't know what I want to be when I grow up. And, well, health goals are different than that. Health goals are more immediate. So, for example, people may want to fit in to a favorite dress or jacket. For me, I want to fit into a favorite vest. That's my sign that my weight is good, that I can wear my favorite vest. People want to go to their grandson's wedding. They want to go somewhere. They want to do something. Those are like they're more immediate than what do I want to be with when I grow up. I see I've got another question. So what's the difference between medical goals and personal health goals? That's really another good question. So medical goals are more related to your diagnosis. So, you have bronchitis, you have ulcers, you have depression, you have multiple sclerosis like me, you have cancer, whatever. Well, medical goals are a lot about treatment and lab work and getting to your appointments. And so they're diagnosis based, but we are not our diagnoses. We are people with aspirations and values and priorities. So we are whole people. We are complex people. So personal goals are what we have for ourselves. Well, we're about out of time, but I have one more question I see. So if I have goals, then what? Well, that's a really good question. So there's a good lead in because my next broadcast is going to be about developing a health team, because people need help with their goals. Very few people can make it on this journey by themselves. So in 2 weeks, on Thursday, August 24th at 11:30, we will have the second of these video casts. So thank you very much for joining me. Have a good day.